Hi, my name is Caitlin Tyler. I am an emergency room nurse at a level one trauma center, and I designed this project to help nurses feel more comfortable with the use of the Belmont Rapid Transfuser in the setting of massive transfusion protocol. The Belmont Rapid Transfuser is a device created by the Belmont Corporation that can deliver fluids or blood components to a patient at rates of up to 1,000 milliliters a minute. The massive transfusion protocol is a policy set in place to rapidly deliver fluids and blood products to patients in their most critical state. Patients must meet criteria in order to run the massive transfusion, and this includes having a high heart rate, low blood pressure, lower than 90 systolic, persistent hemodynamic instability, active bleeding requiring operation or angioembolization, or a positive FAST score, meaning when we ultrasound a trauma patient, they have fluid around their intra-abdominal cavities or around their heart where it should not be. When patients meet this criteria, nurses or techs activate the massive transfusion protocol and then are directed to use the Belmont Rapid Transfuser. The Belmont can be used by both nurses and emergency room techs, and this in-service was geared specifically towards both of these. A lot of nurses endorsed being uncomfortable using the Belmont Rapid Transfuser due to the infrequency in which we use this machine because we don't use it in every trauma, and being unfamiliar with setting it up and not receiving formal training. The objective for this in-service is to design, implement, and evaluate the use of the Belmont Rapid Transfuser in the setting of massive transfusion protocol. I designed this in-service to help nurses and techs feel more comfortable using this tool and to receive hands-on training as well as handouts to refresh their understanding. And I also printed out the policy for running the massive transfusion protocol. During this in-service, I first taught everyone how to set up and gather supplies for the Belmont. The Belmont supplies can be found in our supply room in the department that I ran this in, and are pretty easily accessible. There are three main components to setting up, or prior to setting up the Belmont, and these include the tubing, which you'll see on the left, a liter bag of normal saline, and an extension set. Once the tubing is spiked, you spike it and prime it like you would any normal IV tubing. You spike the bag and hang it on the IV pole. You want to clamp all of the clamps to the tubing prior to spiking the bag, otherwise afterwards it makes it difficult. Once the tubing is spiked and primed, it's good for up to 24 hours, so it's important to label the line when it's spiked and primed. Once you hang it on the IV pole, you align the colors from the tubing with the colors on the Belmont box. You'll see the red and the blue, and those coordinate with the red and the blue on the tubing. It's easiest to start by putting the disc that comes with the tubing in first, and you need to ensure that the red is pointing up and the blue is pointing down. We never want to force any of this tubing into the Belmont because all of the tubing aligns very easily. And if you force the machine, it won't work properly. Once all of the tubing is aligned, you easily shut the door and clamp it down and turn the machine on. You'll see in the picture on the right side, the screen will flash up with the Belmont logo, and it will give you the option to prime the line. You want to go ahead and click prime line. First, you'll want to unclamp all of your clamped clamps, and then select prime. What's going to happen is that the machine will self-prime above the line of the box and in the box all of the fluid, so nothing will actually come out of the line first. The machine will prompt itself after it's self-primed to prime the patient line next. And that's when you'll go ahead and hold it over a trash can and click prime patient line. You'll have to hold this button down and the fluid will continue to prime all the way down to the end of the IV tubing. And you'll just want to prime this like normal to ensure all the air bubbles have been removed. Once you are finished priming the line completely and ensuring all of the air bubbles are removed, you want to attach it directly to the hub of the IV, which needs to be an 18 gauge or larger in order to run a massive transfusion. These large bore IVs are critical in this case because each IV has a maximum flow rate. And if you put one in that's too small or positioned incorrectly, it's not going to be good for running the Belmont. You'll get errors very frequently. The Belmont is smart enough, though, to know a maximum flow rate, so it's not going to burst through and push the fluid. It will alarm frequently, though, and then it just won't work. So it's really, really important to insert large bore IVs. After you set up the line, you're going to connect it to the patient. And this part is very important. You want to connect it directly to the IV catheter hub and the patient's and the tubing of the Belmont. You do not want to have a extension set. You don't want to have a IV hub part on the end. You want to do catheter to IV tubing because the hub only slows down the maximum flow rate. After you initiate or after you connect to the patient, you'll want to initiate the infusion. You'll go ahead and click the 500 milliliters a minute rate, and the Belmont will try and infuse as much as it can. For most 18 gauge IVs, as just from what I've seen, we'll click the 500 milliliters, but we'll run it at about 380 to 400 milliliters a minute. Even though you've clicked the 500, the Belmont will cap out about there, just if we're using a typical 18 or 16 gauge IV. And this chart on this screen actually shows you the maximum achievable flow rate for crystalloids and red blood cells. And you'll see there that the 18 gauge, it just gets about 200 milliliters a minute, which I have seen, if positioned correctly, up to 380 or 400. But really, we want to stick with those cannulas that are just a larger bore, those 16 to 14, if we can. On this page, you'll see on the left here, this is the handout that I gave to everybody. It's an overview of the eligibility criteria for patients who are requiring massive transfusion. And it goes also through the procedure of dialing into our phone to call out a massive transfusion protocol. Calling that out alerts the necessary team. The blood bank then prepares the blood products, and the lab starts running all of that lab work that's needed. The scorekeeper on the right here just keeps track of how much blood products and IV fluid the patient has received. It's very important to connect the blood tubing to the hub without the hub of the IV. So you want to do straight IV catheter to IV tubing. It's very important for clear communication between the head trauma nurse and the Belmont rapid transfuser operator. You want to be calling these out, how many they're getting and when you start it and when you finish. And we infuse at a ratio of 4 to 1 to 1. So 4 units of red blood cells to 1 unit of plasma to 1 unit of platelets. And that just has to do with availability. This is a complex protocol, but it's very easy if you regularly stay up to date with the policy and educate yourself on the use of it, just to be more comfortable. Definitely don't be afraid to ask people on your unit who you know are resources on how to use it, or to just update you, on how to set it up, or how we might run it in the setting of the massive transfusion. I'm excited because I left behind a lot of these handouts and in-service trainings for staff on the unit, and they're going to continue to use this in the future to help nurses feel a lot more comfortable with using the Belmont Rapid Transfuser. Thank you.